Welcome to Philanami episode 5. There's a lot has been said since we started from episode 1. Welcome, Dr. Cuckoo, to episode 5 of Philanami Foundation Podcast. I hope today we are just going back, recapping, because I've seen people have so many pending questions and people want to know about a lot of things. To start, we were discussing treatment from the previous episode, and we've touched here and there mostly about MDR and XDR and kufika njani ukuthi umuntu avele abe ne MDR ne XDR. It's another question that I came across. Can you please ungene kuleyo and be ungene deeper kancane ukuthi okay, mina ngihambe ngema steps nethi angizange ngafika ku XDR as fortunate, but lo munye umuntu uyaqhamuka so inhale ini XDR or MDR akakase abena the normal TB you calling it a standard TB, a standard normal TB. How does one get to that?
Okay. So it's a very good question. So remember, what is 10 the TB bacteria, you inhale it, bese kube yona ifika ihlale in your lungs, and then it causes infection from your lungs. If it spreads into your blood system, then it can start affecting other organs. So there are two ways that people can get EMDR or XDR, but maybe let me start by explaining Lama terms. So MDR means multi-drug resistant TB. XDR means extensively drug-resistant TB. So it's basically. So the difference between the two is the kind of drugs and the number of drugs that don't work for you. Especially if we are looking at lama drugs lawa eswasebenzisa or le medication esisebenzisa for so ibiza ngokuthi normal TB, but in medical terms we call it drug sensitive TB. So the first way is the one lega desikhuluma ngayo in the previous episode, ukuthi it's someone who was diagnosed with drug sensitive TB or the normal TB, and then uthola ukuthi mhlawumbe treatment yakho ibingakusebenzeli. So the treatment not working for you can be because of multiple reasons. One, maybe you are not taking the treatment properly. So awuthathi ngalendlela dokotela or sister eclinic prescribele ngayo. So then the medication is not able to work for you. The second way could be ukuthi you are not taking it properly. So umuntu onokujumpa, we are nathi treatment uphinda uyekele, nathi treatment uphinda uyekele. The other way, remember I spoke about ukuthi medication is dosed according to your weight. So if mhlawumbe let's say ungangami weigh 70 kilograms and kumele uthola amaphilisi awu5, but because awukalanga for whatever reason, sometimes uthola ukuthi abanye abantu bafuna ukuthumela their relatives ukuthi cela uyongithathela amaphilisi ami, cela uyongithathela amaphilisi ami. Angithi sister usabamba ukuthi wena last time I saw you weigh 50 kilograms, but now you're 70, meaning ukuthi le medication asebekunika yona the dose is too small. So that means the medication won't work well for you. So that way you can develop resistance. The other way is now, if I'm a Cuckoo, I've got MDR or I've got XDR, and ngihlala nawe ngiphila nawe, you would then contract the resistant strain from me. So if mina yami strain is drug resistant, nawe chances are your strain will also be drug resistant.
Look, we've spoken about children. You mentioned Guti labanye bantwana batalwa with TB, labanye bayithola at the very young age. I also came across a question, let's see, when you are pregnant and you have TB, what then happens to the child that you are carrying? And when you're taking treatment, does the child naye uyalapheka, or what happens really?
Okay. So if you are pregnant and you have ETB, remember Uti, pregnancy is a state of immunocompromise. So immune system yako is not very strong when you're pregnant. Therefore, the chances of you getting TB mokulele is quite high. So for the mother, ilama complications lawa ajwayelekile ETB, of which even include death. If untreated, you could die from ETB if it remains untreated. But TB can also pass through the placenta to the baby. And that can increase the risk of miscarriage. It can increase the risk of preterm labor. The baby can be born prematurely. The baby can be born with TB, very low birth weight. So those are some of the complications of a TB in someone who's pregnant, for the mother and for the baby.
What causes or what kind of TB that normally causes miscarriages? Like you were mentioning now. I remember I'm hoping I will host her soon, where she'll tell a story. Kuti ubeni abdominal TB, and it made her to have miscarriages or a miscarriage. Does that happen? How does it affect? But the big question now is, what kind of TB that will make a mother who is carrying a baby, expecting, ukuthi agcine athola miscarriage?
So any kind of TB. So whether it's drug-sensitive TB, whether it's drug-resistant TB, can result in the mother ukuthi abe miscarriage early on in pregnancy if she's very unwell.
Even the lung one.
Even the lung one.
Another thing, doctor, that people normally say, ukuthi i-TB treatment uyithola fully ngalokuphelele ka-government. Kuma-government facilities esibhedlela uyayilanza i-treatment yakho i-TB uyithole yonke uphile. E-clinic uyayithola i-TB treatment yakho. Fortunately, when I had TB then, I didn't have medical aid. And I don't know, Gutsi, if I had medical aid, I was going to be still sitting here and talking to you. I don't know. Because many people feel that TB treatment, itholakala kuma public facilities. When you go to private, ukhwehlela, with all the symptoms that we've spoken about, you are not going to get TB treatment. And I remember some time ago, I was speaking to another doctor saying, middle class, bo fortunate, because they have medical aid, they don't want to go by your cure. And you are not going to get a TB treatment a pharmacy, like your ARVs and other medication. TB treatment, vele kufanele emtholampilo, and I don't want to queue. It's not cool. I can't. Pokfola nebandu labakhwehlelako. You know, that's where it comes the stigma in everything. How true it is, or is it? Saying I have viewed, I've seen, I've noticed ukuthi vele na ufuna kuphila from TB, hamba kahulumende utophila beketela lanza i-treatment yakho, you will be fine. Utophila nam, you know. How true is it? Because there's that word out there ukuthi vele mawufuna kuphila ku-TB angeke uzuyithole over the counter. Even bodokotela bayibhala futhi prescription ye-TB kuma private facilities. Can you please explain that?
Okay, that is a very, very good question, actually. So I'll start off by saying, so Shayu, did you know Wagu chippies? So TB is actually the leading infectious killer globally. So in the entire world, during COVID was number one, TB was number two. iteme peli COVID, TB abuyela back to being number one, leading infectious killer in the whole world.
Sorry, doctor, to come in there. There's a research that I saw, it just after COVID, that most people died of TB during COVID. I'm not sure we were sweating. Oh, I also had COVID. COVID. So many people died of TB, state says. And TB being the silent killer like that, and banduna bashona left, right, and center, we all thought it was COVID. Very tectostetsa. Kana in a silent killer here. Ipupisa everybody. Please continue.
Yes. So even if ubuga the top 10 leading causes of death in the whole world globally, TB is one of them. So basically what I'm trying to highlight is the gravity of the situation and the gravity of how dangerous TB can be. But imagine, Wuti, how is an infection that is preventable, that is curable. Like you see, for preventable, curable, but you see number one cause of death globally. It doesn't make any sense. So for that reason, TB is what we call a notifiable condition. So it's a condition that is under surveillance. So as a country and as the whole world, under the World Health Organization, we have to track everyone who is diagnosed with TB. Because I'm sure we've got targets. We want to find 90% of people with TB, 90% of them must be put on treatment, and 90% of them must be treated successfully. So for us to be able to achieve that, and for us to be able to eliminate TB, kungasabi something esikhuluma ngayo, for us to eliminate TB and no longer have TB as the leading infectious killer globally, we have to track it. So Fortunate anga diagnosa, we need to know. Fortunate has been diagnosed with TB. Ukalili treatment, uyabuya for ama visits akhe, and Fortunate has been cured. So that is why TB treatment is only available in government facilities, because the reporting systems are only found in government facilities. So that's the only reason. But now to come to the challenge here to Cuckoo, I'm middle class, I don't want to go a clinic in your for. Government has recognized there's that gap. Has recognized there's that challenge. So what's currently happening is that they're trying to bridge Leo gap. They're making great strides. We're making great strides. So there's a concept called the public-private mix, where now government is trying to now engage private practitioners to help in the fight against TB. So they are still able to diagnose patients with the TB in private facilities and then link them to care to ensure ukuthi labantu laba who have been diagnosed in private can also access care. But unfortunately, fortunately, the reporting systems are only available in government facilities, and that's why unge uzutole a GP, for example, starting you on TB treatment.
You know, I think I'll mention Dr. Zungu's practice. I know there's a section or there's an office there where they test people for TB, and Dr. Zungu is one of the doctors I know who has so much passion in TB, just like you, doctor. So he allowed that section to be there. But because I frequent there and I speak to the lady who works there, and when I ask, my interest with TB is on another level. And honestly, with all of my heart, I want to see le vision your government of fighting TB and end it by 2030 iyendeka qobo vele iphila nami ithi iba khona iqhubeka whether podcast or wherever sisi we fought and we have won. We left with 5 years. And when I speak to the lady who works there, she normally says, "Ngithi khamba njani? Do people come and test?" And she says, "Fortunate. But abafuni kahle." Some they do come and test. Some they said, "No, I'm fine. Next time I don't have TB. I just have flu." And reaching out to people and talking about TB, we are not saying people are, but we're just encouraging people to test, people to know their status. Where are they? Because it's in Mpumalanga, and this is one of the leading province near TB in the country. And because we have mines, there's a lot happening, So we are here just to say, find a way, Tolindlela, to get there. But it's difficult.
I love that you mentioned the practice. So this little room that you're talking about in the practice is actually what I'm talking about. So that's actually a government initiative where they are piloting this public-private mix to say how can we get people from the private sector to be diagnosed with TB. And platforms like this are so important for us to raise the awareness so people can understand the gravity of the situation, so people can understand what the signs are, what the symptoms are. And I think if we have more platforms like this and we have more sessions like this, then we'll definitely have more people coming forward to get tested. We'll have more people wanting to stay on treatment. So I think small steps,
we are getting
but
there.
We will get there.
So I think as Philanami, we saw the gap that people are mostly on social media now. And as a person who went through the stigma and the discrimination because I had TB, and I don't remember hiding that I have TB in anyhow. But I know, Guti, for some people it's not easy. We have family members, we have friends that I will constantly go and talk to and do some counseling. Go say, no, come back, fight. I always encourage people to fight because I know that when you fight, we appeal. Gugula awugulapi ngale TB treatment mentally. You must have the spirit as well. So I'm going to fight this. I'm gonna go back. Yes, I had TB the first time. I'm gonna go back and have a treatment for the second time, and I'm going to make it. If by fortunate have done it, I will also do it. That is why we are here. We are not here just to have fun, but it breaks our heart. Guti giyazanywa, but we are still sibonakala ngathi we are failing, like you've mentioned. Guti globally it is still a problem, issue TB. So hence I'm saying we are going to fight it ngayo yonke indlela. Doc, as we are wrapping this episode and with many people asking questions, and I know that we are still going to come across so many questions, meaning ngihamba ngibo emarenkini and do the campaigns. I do go to different communities. There's another event coming very soon now, Leyendiwa Imbombela. There's a section where they are dealing with TB. Fortunately now I sit in those committees and we identify places and how to strategize and get into those people. We're having my work, and then we call people, we teach them, educate, we go within a organization, islangane, and when you ma test, get such but we need to win. The budget lekhishwa TB yendani, so it's still because actually is, and because of people bayajajwa, people are being discriminate because now TB nalal plate lago. I think we've mentioned the previous episode, and we are still going to talk about it even more with the upcoming episode. So it's an issue that it's very painful and it's out there. But as we are rapping now, because we must rap, what can you say with all these burning questions that people had, and going forward, people have been asking, they are still going to ask, and we receive questions every day. What can you say as we rap just now?
I would say that we are so grateful for platforms like this that allows us to be face to face and in the room of the service user. So you'll project the number, people must call, ask kungahlali ekhaya with that burning question, drop a message, call, ask, and we'll definitely slot it in to our upcoming episodes and answer those burning questions.
Yeah, you can also follow us on Facebook, Philanami Foundation. We'll be on Instagram, on Twitter. You can follow us. You can drop us a DM and ask. You can WhatsApp us on the number on the screen and just WhatsApp ask. Even if you are shy, we'll be there to take you to the clinic. We'll be there to support you. And if you know that you took your treatment for a few months and you never finished your course, please call Philanami. We'll be here for you to assist you for the treatment, because we need to win you back to the system, finish your course, so that the TB treatment, the TB bacteria cannot be spread all over the place. Doctor, thank you so much for your time.
Thank you so much.
This was episode 5.
Thank you.